Hi, my name is Preska. I'm here to do a head to toe assessment. Is that okay with you?
Yes.
Okay. I did my hand hygiene. I provided privacy, and I'm here to do head to toe assessment with my patient. What is your name?
Jessica Obenaya.
Oh, Jessica. Okay, Jessica. And how old are you?
I'm 18 years old.
Oh, okay. And do you know why you're here?
I'm here for a head to toe assessment.
And then, do you know where you are?
I'm at the hospital.
Oh, okay. Do you know the president of America?
Donald Trump.
Oh, okay. Okay. I'm able to ask my patient her name. She's able to tell me her name, her age, her why she's here, and where she is. So my patient is alert oriented times 4. Now I'm gonna like I said, I'm here to do the head to toe assessment. To do the head to toe assessment, you have to start with inspection, palpation, percussion, and auscultation, except when you reach the abdomen, it differs. Then at the on the abdomen, you have to do inspection, auscultation second, percussion, and then palpation. Why we're doing auscultation on the abdomen, so that why we're doing auscultation second instead of percussion, so that it will not alter the abdominal sound. So now I provided privacy. So I'm gonna start with you. Okay. I wash my hands. Then I'm gonna introduce myself. So I'm starting with the head to toe assessment. While I'm doing this also, I'm looking at my patient. I'm looking at her facial expression. I'm looking at how neat she is. Is she pleasant? Is she okay? Is she clean does she smell? But my patient appear clean, neat, pleasant. So now I'm gonna do the vital signs. I'm gonna do your vital signs, okay? I'm gonna check the temperature, pulse, respiration, and BP. And while doing that, can I check your vital signs, please? So here I'm checking the blood pressure. I'm checking the blood pressure. Down, out. Okay, I check the blood pressure. Okay. Okay, her blood pressure is normal. Okay. Good. Her blood pressure is normal. And then I have to check the temperature. I have to check the pulse. It's strong, regular. I'll check the oxygen saturation too. That I don't have those things here, but I'm gonna check the oxygen saturation. Then after that, then I'm looking at my patient. I have to look at the facial expression. I'm looking at the facial expression. I'm looking if the face is equal. There is no drooping, like in Ehlers palsy. There is no drooping. There is equal, is symmetrical, and the eyes also is the face is well symmetrical. Then now I'm gonna put on my glove because I have to start from the head. Now when I put on my gloves, I have to assess the head. First of all, I have to do palpation. So on assessment of the head, I'm doing palpation. So I wear my gloves. Okay, I put on my gloves. So here, I'm gonna check for the hair distribution. In as much as to braid her hair is well distributed. I'm looking for masses, for any lesions. Do you feel any pain?
No.
Okay, I'm looking if there is any infestation. I'm also looking if there is any ulcer. Because most patients usually have an hospital ulcer because they usually lay on their back. So her hair is intact. and well distributed to the body. And while I'm doing all these things, I'm looking at her age to make sure her age matches her look, and her color matches her ethnicity. Now again, I'm gonna remove my gloves and perform another hand hygiene with my alcohol. I'll perform another hand hygiene. Then I'll come to the face. Now I'm looking at the face. On the face here, I'm gonna assess for the cranial nerve 7, which is the facial nerve. I'm gonna tell her to close. Okay, can you close your eyes? Squeeze your eyes. Open. Smile. Angry face. Pop. Yeah. Okay, she's able to do this with ease, which means the cranial nerve 7 is intact. Then I'll have to. Then the next thing I will do. I have to check for the sinuses. Let me know if you feel any pain. Is intact, and there's the maxillary sinuses and the frontal sinuses. Then I'm gonna look at the eyes. Make sure that the eyes, here on the eyes, I'm checking at the pupil, the iris, and the conjunctiva to make sure that there is no swelling, there's no discharge, the conjunctiva is well, there's no redness, there's no jaundice. She's okay. Then here also, I'm gonna check for at the same. Then I'm gonna palpate the temporal arch. I'll put the light on and allow her to look at a far object, and then I'm going to allow her to stare off a distant object, and then to see how she dilates with the pupils, or how it constricts. Then I'm gonna use how the eye reacts with light. All right. Mm-hmm. See, the eye constrict with light from 3 to 1. The same way we go like this. Okay, good. So we assess for accommodation. So on accommodation, I want to make sure how the eye also how the look at the object over there, and you gaze at it, and then just off the light. Okay, I'll put the light on again. After dimming the light to check for the eyes reacting with the light, then I have to put the light again to check for accommodation. Then I'm gonna ask you to watch at the far distance and to see how the eye dilates with object. So as you're watch it there, then I'm gonna use my pen light, and I will go like straight. See how the eyes cross with each other. Okay, she's able to do it. Now I can now I can document that the pupils are equal, they are round, and they react with light, and also accommodate. That's why we get the acronym DEPALA. So after this, then I have to inspect the ear. On inspecting the ear, meanwhile, well, we're supposed to do the optic nerve, which is the Snelling test, in which I will ask my patient to look at, to read on something on the wall, to check I'll do the Snelling test. If she's able to read on the wall, then if it's 20/20, which means the eyes is okay. Then now I'm gonna check the ear. On checking the ear, I have to check the ear, palpate the ear, make sure that there's no lesions, there's no swelling. Do you feel any pain?
No.
Okay, make sure there is nothing. I'll check at the back of the ear, then I will use my otoscope to, then I'll put the ear up and backward. With my otoscope, I have to put it inside the ear to check for any discharge, any wax, and then and the cone of the light of the ear. For the right ear, the cone will be at 5 o'clock, and with the left ear, the cone of the light will be at 7 o'clock. So the ear is equal, no discharge, no swelling. Then I have to go to the nose. Then at the nose is well situated at the middle of the face. I have to check for the septum. There's no deviation, there's no discharge, there's no swelling, there's no tenderness. And then I'm going to use, there is no standard, there's no there is no tenderness. Now this time I'm gonna check for cranial nerve 1, which is the olfactory, which is the sense of smell. I'm gonna ask you to close your eyes and you tell me if what you can smell. Okay, I'll put it over to her nose. Do you smell anything?
Yes.
What do you smell?
Alcohol.
Good. She's able to smell, which means that the cranial nerve 1 is intact. Then I'll go to the mouth. Can you open your mouth? Now I have to put my gloves again, but I have to access the mouth. I put my gloves on. I put my gloves on. And then with my spatula, can you open your mouth? Okay, I'm gonna make sure, I'm looking at if there's any dental caries, if there's any lesions, any mass. Can you bring out your tongue, please? The tongue is okay, it's juicy and moist, it's not dry. So I'm looking at them here. I can now assess for, okay, now I can hear. I will look at the uvula. Now I can, okay, here on this one with the uvula you have to assess for cranial nerve 12, which is the hypoglossal ha. Say ha.
Ha.
She's able to say with ease. Then you look at the lips. The lips is there. The lips, there's no crack, there's no swelling. Then we have to look at cranial nerve. The glossopharyngeal. She's okay. Good. Put your tongue. Okay, good. She's able to move the tongue with ease. Good. So the cranial nerve is intact. Close the mouth. Then say ha.
Ha.
Okay, good. Then here we assess the vagus nerve, which can swallow with ease, and then the vagus nerve, the cranial nerve 10 is intact. Then I'm gonna remove my gloves. So we've checked for the hypoglossal, the glossopharyngeal. Now we forgot to check the vestibulocochlear nerve, which is the cranial nerve 8 for hearing. I'm gonna close your ears. I'm gonna close your ear and tell me if you can hear what I said. Orange banana.
Orange banana.
Apple.
Apple grape.
Okay, she's able to. She has no hearing loss. She's able to say what I said. Then I can use the tuning fork. Let me assume this is my tuning fork. I can use an improvise to assess for air conduction and bone conduction. So with my tuning fork here, I can ask her if can you hear on all the sides?
Yes.
Okay, good. So she's able to hear with the tuning fork. She can hear on all sides, and then also I can put it to the ear, which is the bone conduction. Okay, can you hear?
Yes. So
normally the air conduction is usually greater than the bone conduction. Then we have to go to the neck. I'm gonna look at the neck. Make sure the neck is well situated. I'm gonna palpate the trachea. The trachea is well situated, and because of privacy, it's well situated. Okay, can you move your neck this side? Again, she's able to move her head, and then I can check for cranial nerve 11, which is the accent. Can you shrug your head? she's able to, okay, down. She's able to do with ease, which means the cranial nerve 11 is intact. Okay, now I'm gonna check the I'm gonna check for the jugular vein. Check for the jugular vein, and then here I'm gonna check for the lymph nodes. I'm gonna palpate the lymph node to make sure if there is no swelling, there's no inflammation. So I'm gonna start with the pre-auricular nodes, the post-auricular, the occipital, the tonsil, the periodic node, the submandibular node, the submental, the superior cervical node, the posterior cervical, and then to here I'll have the superior clavicular node to make sure there is no pain, there's no tenderness, it's all intact. Okay, then I'm going to assess for the carotid artery. This one you have to do it one at a time. Its 2 pleusis is intact. Its 2 pleusis is intact. Then I'm gonna use the bell of the stethoscope to listen to the bruit sound of the carotid artery. So here, the swishing sound. Good. Now I'm gonna assess for the upper extremities. Okay, I'm looking at the hand to make sure it's okay. I'm gonna check the radial pulse is 2 pleusis intact. The brachial pulse is intact. The capillary refill press down is able to return in 2 minutes. I'll tell you, okay, can you squeeze my hand? So she's able to do it. Can you push my hand? She's able to do it with ease. Then I'm gonna check for the for the drift. Close your eyes. She's up. Okay, good. See, there is no upward drift like you can see in a patient with stroke. You can open your eyes. Now I'm gonna assess the chest. Normally, for privacy's sake, I'm not gonna open her chest, but you have to assess for the chest. Look, make sure, check if she's breathing with the accessory muscles. Check if there's any lump, any lesion, any tenderness. Do you feel any pain?
No.
Okay, good. And then when you assess when you're looking at the barrel chest, also make sure there is no barrel chest like you see in COPD. Her chest is even and well distributed. Okay, now I'm gonna check for the heart sound. On checking out the heart sound, I'm gonna use the bell of the stethoscope. So here I'm gonna check the heart sound. I'm gonna start from the so-called intercostal space. I'm gonna listen to it. I'm gonna hear lob dub S1 S1. Then I go to here is the aortic. Another, so the left second intercostal space, you have the pulmonic lob dub S1 S1. Then down you have the F point, you have the tricuspid, and then finally we have the mitral valve, which is the same thing, lob dub. There's no abnormality. Also, you can also do the same with the bell to listen for any squeezing sound. The same thing, I go this way again. Down here, the third, the fourth, and then the fifth. Good. There's no abnormality. Then here I have to check, I have to also assess for the lung sound. On the lung sound, we are assessing for abnormal sound of the lungs. We are looking for crackles, abnormal sound, wheezes, stridor, and friction rub. So here we're gonna look. We're gonna assess the lung. Remember the lungs. On the right lung we have the 3 lobes, and the left lung we have the 2 lobes. So I'm gonna start from the apex of the lung using my diaphragm. I have to look if I assess for any abnormal sound. So then I'll go to the second intercostal space. The second intercostal space. Remember, on the left lung, because it's 3 lobes, I have to go to the 4th. Then I go to the 3rd on the right. Then I go. And I'll go to the mid axillary. Same here. After that, I will also use the bell of the stethoscope to do the same thing from the apex. From the apex, from the second intercostal, the 4th intercostal, the 3rd intercostal, and then we'll go the 5th, the mid axillary, and the mid axillary. So after that, we can also check, tell the patient to turn her back. We breathe in. We have to do the same thing. Breathing again out. As we are assessing the lung sound, we have to tell the patient to breathe in and out, for us to see if there's any abnormality. Then again, the same thing we did in the front. We'll go to the back. We'll do the same thing, and then it's okay. Then we'll go. Now we have to assess the abdomen. And assessing the abdomen, I'm gonna tell you to lie down. Okay? Can you lie down? So I'm gonna assess her abdomen. On the abdomen, remember we say on the abdomen, we have to do palpation, auscultation, percussion, and inspection. So that we'll do the auscultation second to avoid uttering the vowel sound. So I'm gonna look at the abdomen. I'm sorry, I'm gonna look at you. Looking at the abdomen, we'll look at the side. The abdomen is round, is okay. We look at any mass. We look at any abnormal color. So the abdomen is intact. Then here, I'm gonna palpate the abdomen. When palpating remember also we can assess for the okay. I'm going to palpate auscultate the abdomen using the bell. We feel for the femoral artery, the renal artery. Sorry, it's okay. From the right lower quadrant to the upper quadrant to the umbilicus. We listen to the vowel sound, and you see there is vowel sound on all the 4 quadrants. Now I'm gonna palpate the abdomen. On palpating the abdomen, we have to do light palpation. So here I'm starting with the light palpation. I'm just going 2 cm deep. So I started with the lower quadrant. I'm looking for mass, for tenderness. Do you feel any pain?
No.
Any pain?
No.
So after this, I'm gonna do my deep palpation, which in this case I'm going deep. I have to do to 4 to 5 cm. Again, I'm looking for any abnormality, any mass. So I'm gonna go deep. I can use my 2 hands, go like this. Do you feel any pain?
No.
From the lower quadrant to the upper quadrant to the umbilicus to the left iliac fossa. There is no pain. Okay. She did not feel any pain. She is okay. Now with this, I can go to the lower extremities. Here I'm gonna look at the distribution. Don't look. I'm gonna look at the distribution of the feet. Okay, I'm looking at the distribution of the hair. I'm checking if there is any edema, if there's any swelling. I can do my range of motion. Then I can do my range of motion. Make sure the toes, there is no fungi, there is oh, Jesus Christ, I'm sorry. Okay, I'm here. I'm looking. There is no edema. Okay, then I will feel the the pulses. Feel the popliteal pulse is 2 pulses. Then I can wear my gloves again because I have to look at the toes to make sure there is no infection. There is no all right. I'm gonna check for the pedial pulse, the dorsal pulse. Look at the toes. There is no infection. If there is any wound. For diabetes patient, you have to check for the reflex action, the Babinski reflex. You look at the heels, it's okay. Do your range of motion. She is fine. Okay, now I'm gonna tell you to sit up. I'm gonna remove my gloves again. I'll do my hand hygiene. I don't have my pin. Okay, I'll do my hand hygiene. So now I'm gonna do for okay, I'm gonna check for I'm going to check for stenogenesis. I'm gonna put a key in her hand and tell me, what is this?
A key.
Okay, good. She's able to identify that is a key. Then put it back. Then I will also check for graftasia, in which I will write an object. What did I write?
A.
Good. She's able to identify the object I wrote on her hand, and then I'm going to use the 2 points discrimination, the dull and the sharp. So here,
Sharp. Dull.
okay, she's able to identify the 2-point discrimination, the dull and the sharp object. Then, okay, I'm gonna ask you another question again. Then I have to assess the back to make sure there is no curve, there's no kyphosis. Make sure the curve is all there's no kyphosis, there's no sclerosis. So I'm looking at everything is intact. So this here we come to the end of our head to toe assessment. And thank you very much.
Thank you very much.
Okay.